Hello, this is Roland. Today I want to begin a series of programs about health, the spiritual side of health. There is a mind-body connection, we all know that. And we know that how our attitude determines, Zig Ziglar always used to say, your attitude determines your altitude. Okay? Well, your attitude also determines, has a lot to do with your health in a lot of ways. For example, we all know that anger is not good. We know that. But now let's talk about something a little more subtle, resentment. Resentment is the precursor of anger. Okay? Resentment can be very subtle, but it's very deadly. You could have a whole series of programs called the diseases of resentment. Resentment figures in on so many things because first of all, it's a denial, and secondly, it's hatred. See, by resenting other people and so on. Undoubtedly figured in somehow with the onslaught or the inception of what issues you have now. You know how one thing leads to another in a very sometimes complicated and not easy to figure out manner. But then when the illness does strike, then it is of utmost importance that you get your ducks in a row, that you amend whatever it was that you've been doing wrong, undoubtedly resenting people, being angry, being full of judgment. See, for example, that has to be changed. See, otherwise, the issue now will loom larger and larger. And it's very difficult to recover when your recovery is complicated by resentment, hostility, rage, anger. See? And what do they lead to? They also lead to unhappiness. See? So if it can be proactive, if ahead of time you can see that you're resenting your mom, or you're resenting your husband, or you're judging your husband, or you're angry at your wife, or you're impatient with your kids, if you can begin to see those ahead of time and let go of those, let go of that wrong attitude, really. You can let go of it. Learn to be more forgiving. Learn to overlook. Learn to be more patient. If you really can learn that, then you may head off at the pass some things that would develop.